If the international community continues to ignore that Yemen is the world's worst humanitarian crisis, the conditions will only continue to worsen and more people will die. Today, and after almost 27 months of war on Yemen, the economy is nearly collapsed. Public and private services have all but disappeared, and Yemenis have lost most of their livelihoods and depleted most of their savings. According to the UN statistics regarding the health sector, there is nearly half of all health facilities that are non-functional. An estimated 14.8 million people lack access to basic health care, including 8.8 million living in severely underserved areas. Medicine and medical supplies and materials are chronically short supply, if not non-existent.
Sabe amarte, abusa de ti. El hombre que tú amas no te aprecia y no merece tu corazón.
The war in Yemen has devastated the lives of millions of people in all different sectors, and as a result of the war, health sector was affected badly. Not only that, but also infectious diseases started appearing everywhere in the country. We have noticed lately that a cholera epidemic started spreading very fast in the country, deteriorating the lives of millions of Yemenis who started suffering due to the lack of health services in their country. Cholera outbreak for the first time was confirmed in Yemen in October 2016 in the capital Sana'a, but in May 2017, new cases were being diagnosed at a rate 3 times higher than initial estimates. And a quarter of the dead so far are children. The cholera outbreak was spreading, with almost 1 person an hour dying from the waterborne infection, according to the World Health Organization, along with 5,000 new diagnoses a day. Now, the number of acute watery diarrhea, known as AWD, suspected cholera cases has increased dramatically, and the cholera outbreak expanded to 22 out of 23 governorates. The cholera epidemic in Yemen is extremely serious and threatens almost all Yemeni people. The number of deaths is 1,678 that have been reported in 22 of 23 Yemen governorates. The situation is extremely serious as the epidemic threatens almost all Yemeni people if the international community continues to ignore that Yemen is the world's worst humanitarian crisis.